roll for this morning.
Director Garza is absent. Director Prendergast?
Present.
Director Story?
Present.
Chair Guggenheim?
Present.
And for the record, those directors also present. Director Harrington
Present.
and Director Keding.
Present.
You have a quorum.
Thank you. And do we have Ms. Merriweather on the call or not?
She indicated that she is actually on a flight, but she was going to try to connect in at some point.
Okay, thanks very much. We'll acknowledge her if she manages to join us. So I'm calling the meeting to order, and we've called the roll. The next committee meeting will be held on Friday, the 17th of June, and at 11 a.m. And do we have any public testimony this morning?
We did not receive any.
Fine. Then we'll carry on to reports on quality and patient safety matters. And I think Leslie Frayne, the Associate Chief Quality Officer, is going to review the HRO dashboard. Leslie, it's all yours.
Yes, thank you. Good morning, everybody. Walk you through our HRO dashboard. Our first slide is our 30-day readmission rate. This is our 30-day unplanned all-cause readmissions to Stroger. There was actually a slight increase in this between December and January from 7.7 to 8.8. And although you see that increase, we still met both the internal target and stretch goals, as well as outperformed the Vizient benchmark. Several of the service lines that observed this decrease included general medicine, general surgery, cardiology, and also oncology. The next slide is our 30-day CMI for our surgical case mix index. This showed an increase between January and February from 3.051 to I'm sorry, I'm on the medical, correct? I thought I advanced my notes to the surgical. Stay on the medical, Deb, I'm sorry. So our medical MSDRG showed a decrease between January and February for 1.449 to 1.262. This decrease was directly related to a decrease in the percent of patients with COVID in February as compared to the previous month. So in January, nearly 1 in 3 patients, so 33 of our patients had a COVID diagnosis. And in February, only 9%. So this was definitely impactful during this month. Even with this decrease, however, we did meet the internal target goal, and we continue to outperform against the Vizient mean in comparable hospitals. So now we can advance to the surgical. Sorry about that. This actually showed an increase between January and February from 3.051 to 3.122 and performed above the internal target goal. The increase was related to improvements observed in neurosurgery, orthopedics, and pulmonary critical care areas. We continue to work with our clinical documentation improvement specialists in this area. Some data from them in March, there were over 1,300 patient discharges reviewed by the CDI team, which is about 98% of all of our inpatient discharges. And in those reviews, the physicians agreed with the CDI recommendation, 93% of the cases, and this actually resulted in a nearly $500,000 financial gain for this month. So in the most recent fiscal year to date, the CDI process has actually resulted in a 5.8 million total gains from this query process with the CDIs and physicians. So definitely not only a gain in financial, but also in our case mix index. In addition, we continue to work with the targeted service lines and providing education. This is ongoing. I report this every time in trauma, surgery, critical care, cardiology, vascular surgery, and also OB-GYN. What is new this time around, we have added a physician that has been appointed, Dr. Gabasho. This is a new leadership role here in Cook County Health. and his official title is the first physician advisor. So he will work with leadership to identify opportunities in improving care and documentation, and also provide guidance and education around documentation requirements that support coding, reimbursement, quality outcomes, and measurement. We're actually very excited about this new role and how impactful it can be on our improved documentation. And also the clinical documentation team will be reporting to this committee next month for even more updates. Next slide. This is our top box score for recommend the hospital for Stroger. This actually increased between February and March from 73.33 to 74.80, and it was reached the 71st percentile against all hospitals in Presque Isle, and we met both target and stretch goals for March. Nearly all of the measures showed improvement between February and March, and some of the actions and updates since our last report. We did have our second patient family advisory council that was held in May. We actually had one patient, and then we had one patient's daughter attend, which was very nice. The patient couldn't attend, but the daughter attended it in his absence. They discussed several issues, some of them at high level, and needing to improve our call center. So based on this discussion, we are working on some tactics to automate calls and provide information to patients faster when they're calling our clinics and outpatient areas, and also several areas and our opportunities for interpretive services. The patient daughter that attended was, the patient was actually a Spanish speaking only patient, and this daughter attended all his visits with her father to, act as an interpreter and go through the system with him. So it was really interesting to hear some of the things that she told us about our opportunities and actually how her father felt in certain circumstances. So we really learned a lot from having this session and talking about these issues. It was really beneficial. We are also working on response rates. The Stroger's response rate was only around 12%. So to help increase this, I think I mentioned last time, we have now put this portal to encourage them to complete the surveys. And this is showing slight improvement, but still not the end all be all, but we'll try everything here. And then also, since most of our patients are coming through the ED, we are working on fixing some of our waiting areas in the ED to make it more comfortable. Giving it new paint, facelift, more comfortable chairs, and working on some more vending and refreshments available to our patients. We're also working on simplifying the discharge papers for our patients, making them more user-friendly and legible, and also putting them at an actual third grade level for reading. So that's another initiative we're working on. And much more. These are just some of the high level from Ling Dang, our Chief Experience Officer. Our next slide is our hemoglobin A1C greater than 9, which we all know is the percent of our diabetic patients with a hemoglobin A1C greater than 9. For our in-care patients, which are patients that receive at least 2 clinic visits within 2 years. The goal is 24%, which reflects the top decile performance. And although we did not reach our goal in this period, we still remain as a top performer for this metric. Some of the action items since I reported last going on in the clinics. Our leaders are heading this HEDIS improvement metrics with all 5 of the HEDIS that includes this. And on May 10th, they actually had a 2-hour training that was held with all of the clinical DIA leaders, which were the physicians and clinical managers. This was held to discuss the top 3 challenges affecting our current workflows in order to create future state workflows. So this was a comparison between current state and future state, and then coming up with very focused initiatives and operationalizing them and standardizing them across all clinics. So we really felt that this session was a great success, and they'll be coming again to meet again very soon to talk about those specific action items. And next slide is data definitions. Any questions on those? All right, I'll move on to regulatory then. So I'm happy to report, since we met last, we did have our Provident CAP survey, which occurred on May 12th, and we have a round of applause there because they did excellent. 3 very low-level citations, and the surveyor gave us great accolades from the survey team. They said labs the size of Provident typically receive between 8 to 10 citations. So the fact that we received 3, they were very low level. The surveyors also commented that the lab was managed very well and was excellent, and above all, very safe. So great job to the team. A lot of hard work went into getting that lab ready for this survey. You know, we've been working on that for actually the last year. Had a lot of improvements, a lot of action items, and it all came together for the survey. So now we'll work on sustainment of all of those. So great job to the team. We'll also preparing for a Stroger trauma designation survey. This will be a new survey for Stroger designation. We expect possibly December of 2022. There is some talk that we might even push that back a little bit to allow us more time to prepare. There also is a lot of work that goes into this. We want to be sure that we're ready. This is voluntary, but it's also a very good recognition to receive. So we want to make sure that we're ready. Also, Stroger stroke certification, our window will open in July. So they'll come anytime between July and December. We do find out the date of this. So hopefully we'll be finding that out in the next couple of months. Our consultant team, QHR, did host a mock survey there in April. The report was received last week, and the stroke team is working very diligently on those action items and has been doing a great job. We're also expecting a Joint Commission extension survey for the mobile MRI that opened at Provident. That'll be a 1-day, expected in July. And also for our Belmont Cragen Health Center, because they opened, will receive a Joint Commission extension survey. Again, a 1-day unannounced, and that date to be determined. So that's it for our regulatory update. Any questions or comments? All right, thank you.
Director Guggenheim, you're muted.
I'm sorry, I do apologize. We're going to move on now to action items. And I believe Dr. O'Brien is going to present one more clinical training affiliation agreement. Dr. O'Brien, are you on the call?
Yes, thank you. And I apologize, this did not get presented with the other agreements last month, but Franciscan St. James has got new leadership in their medical education office, and we needed to establish what the salaries were for this year, so I couldn't present it accurately last month. So along with the other agreements that I presented last month, this is a renewal, and there are 2 residents, a orthopedic 2nd year and an orthopedic 4th year, and as you can see there, the contract length is 3 years.
Sorry, any questions? No? Well, thank you. We will hold this recommendation then for the combined motion. And we'll now move on to the executive medical staff reports and deal with the appointments, reappointments of medical staff. Dr. Akintorin, please go ahead.
Yes, good morning. I presenting a report of our credentials committee as accepted by the EMS at the last meeting of last Tuesday. These are the report of the staff, medical staff appointments, reappointment to the board of directors. The document has been passed on to you. Thank you. Then I will present the summary of the HQPS committee minutes of their meeting of March 12, 2022. The meeting took place on March 12th, and the chair is Dr. Christophe Pierco. And the March report on the quality and patient safety update, quality/HR dashboard, contracts, stroke, the patient safety. The highlights, the majority of the indicators continue to be favorable to go, and topics of discussion and follow-up included quality HR dashboard, the surgical case mix index increased between November and December from 3.06% to 3.13%, which made the internal and the stretch and target stretch goals. The medical case mix index increased between November and December from 1.264 to 1.339. That's about 0.1% increase. And both met the target and the stretch goals. For the stroke patients without a procedure, they met the February 22 goal of 90% for completion of the NIH stroke scale. For patients discharged on antithrombotic, compliance was at 100% for February, which exceeded the goal of 90%. And for patients that were discharged on statin, for February there was 100% compliance, which exceeded the goal of 90%. The HRO diet readmissions work group, hospital-wide readmissions, the 2021 readmit rate for congestive heart failure patients has improved to 40.2%, which is better than the 2021 national average of 17.75%. Stroger Hospital performs in the top quartile for heart failure readmissions at 14.1% and almost in the top decile for 7-day readmission at 3.58%. There are some initiatives to improve our top box score. These are improvement in outpatient access to reduce ED visits, family engagement, transition of care team, heart failure education, and medication reconciliation. Thank you. If there are any questions on this, I'll be ready to answer.
Any questions? Well, thank you very much, Akintorin. And hearing none, we will proceed to consider the recommendations from the Provident Hospital medical staff. I believe that we do not have Dr. Kirby with us this morning as he has clinical duties, but you have received ahead of the meeting the lists of recommended appointments, reappointments, and changes. So the third item we need to consider is the Quality and Patient Safety Committee minutes from the previous meeting. They were approved by the board at the April meeting, but they are presented today for the committee's review and discussion should that be necessary. And if there are any corrections to be made, please let me know now. And hearing none, I will ask for a combined motion to, one, approve item 4A, the proposed clinical training affiliation agreement, to approve the item 4C, Stroger Hospital medical staff appointments, reappointments and changes, item 4C, Provident Hospital medical staff appointments, reappointments and changes, and the Quality and Patient Safety Committee meeting minutes of April the 21st. And do I have a motion to that effect?
So moved.
Thank you. And is there a second? I think that would be Director Story. Is there a second to the motion, please? If not, I will second the motion. Debbie, would you call the roll, please, on the combined motion?
Roll call on the combined motion. Aye or nay, Director Garza is absent. Director Prendergast?
Aye.
Director Story? Director Story?
Yes, we've lost him.
He might have just stepped away. And Chair Guggenheim.
Aye.
So you have 2 ayes and 2 absent.
Okay, so the motion is approved. Finally, we are planning to go into closed session this morning, and that is pursuant to the following exceptions to the Open Meetings Act, 5 ILCS 120/2C 11, 12, and 17. And I need a roll call vote for us to go into closed session. Do I have a motion?
So moved.
Thank you. And I will second that again. And would you call the roll, Debbie?
Roll call vote on the motion to go into closed session. Aye or nay, Director Garza is absent. Director Prendergast?
Aye.
Director Story is absent. And Chair Guggenheim.
Aye.
So you have 2 yeas and 2 absent.
All right. I'll temporarily say goodbye, and we'll meet again on the other side.